back with part 2, where we're actually going to do the infusion itself and go through that whole process and everything. Before we get started, I just want to let you guys all know, I double washed my hands. I haven't touched anything. Before I set all of these medical supplies out, I bleached and cleaned and disinfected the entire table area. My animals have been put away into a separate room to avoid any contamination of anything. When you have a PICC line, your biggest fear should be getting an infection in your line. And in order to do that, cleanliness is everything. You can't over clean in my book in order to prevent such things. So that was my first protocol that I did. Like I said, I washed my hands and I washed it for at least 30 seconds. And then this was all bleached before all of this was taken and laid out. Now, to start the infusion, I'm kind of give you guys an idea exactly. I'm on 2 medications. The medications are this one right here, which is an IV push medication. It's called Rocephin. I've been on that for over 6 months now. And we're not sure how much longer I'm going to be on it. It might not be too much longer. We're just kind of seeing how my body reacts and how my symptoms are doing and improving and what's going on. It's really, every case is unique and different unto its own, just like we are made in such a way. So that's kind of one thing that is complicated, because some people can respond to certain medications, other people don't. The disease also mutates in your body and stuff like that, so that's another issue that they have to deal with, and also why they'll switch up the medications. So this is the IV Rocephin, which is commonly used for treating Lyme's disease, and again, that's a push IV. So we're going to be administering that medication today. And then in this little bottle right here, we've got IV Septra. And IV Septra, obviously you can't put this inside of your line. So IV Septra has a short shelf life of 6 hours, and you have to mix it at home. So I'm going to be going through the mixing process and all that kind of stuff as well with you. Before we get started, what I would like to do is just give you a quick little overview here, okay? So I found this exceedingly helpful when I first started my infusions. I would lay it out and lay my medications on top. It's just kind of a really nice guideline and reference. And pretty much I found the general rule of thumb when doing infusions with a PICC line is that you always start with a saline flush, then you're going to administer whatever medications you're going to do, and then you're going to flush your line again with a saline flush. And then once you've done that, usually at the end you finish off with something called heparin, which is a blood thinner. So you don't want to get blood clots or build up on top of the PICC line that's inside of your heart. So they put this in there to help prevent that. And also the big issue is with Lyme's patients, your blood tends to coagulate, so that becomes an issue, and they want to make sure that you're getting the proper blood thinner so that your line doesn't get plugged up on you. Okay, so this is the basic structuring of how you administer medications. The thing is that I'm sure you just heard me mention that I have 2 medications. So instead of doing 2 completely separate IV infusions, I combine them and do them consecutively one after another. The reason that I do this is that if I have to do 4 infusions technically in a day. And if I was doing 4 infusions in a day and I was laying it all out like this every single time, I would be using 2 times the amount of saline and heparin. And in doing that, it's just better to, you don't want to put foreign things into your body. So the less stuff that you can put in, the better for you. And also, you don't want to put in a lot of heparin in your body. That's not good for you. So this is how I've been taught to do it. When I first started my IV infusions, I was not on the IV Septra. I was just on the Rocephin. And so how we would generally set that up is, and this is the key thing, always set your stuff up and have everything laid out, because if you're anything like me and you're forgetful, you don't want to you want to be sure that you did what you did, and you want to make sure you're not making any mistakes and making sure that you're keeping track of it all. And I find by laying it all out and doing it one by one, it allows for the least amount of mistakes to occur. Okay, so I've laid this out. This is a sterile draping that I get from my pharmacy to do these. Now, if I was just doing the Rocephin, when I originally started IV medications, I was only on Rocephin. I've been on a few now, but I'll talk about that more in other videos. So you always want to start, like I said, you want to lay out your saline, you want to lay out your Rocephin, and then another saline, and then you would usually finish with the heparin. Now that would be if I was just doing the one infusion on its own. Like I said, for efficiency purposes, I do them simultaneously. It'll also make the video better for doing, because you won't have to sit for 5 minutes through just pushing an IV into me. We'll get to mix the medication during that process. So the way that we do it to add in the next infusion is you always want to make sure you've got a saline between your infusions. Keep in mind, folks, I am only a patient. I am not a medical trained professional. If you have any questions, you need to consult your pharmacist or your doctor. Different medications interact differently, and there can be problems, and I'm not educated enough on all that subject matter, and everybody's situation and medication is different. So this is solely to my situation. Please, like I said, learn whatever protocol it is that they want and make sure that you follow it. However, if you are doing IV medications, this is kind of a good video to get an idea of how it's done, and you can kind of follow the basic rules. Just the only thing that'll be different is possibly how you administer your medications. So, alright, I'm going to add in this right here, and I kind of just lay everything out in the order in which it's going to be put into my body. And now, because I'm adding this, I'm going to need to add another saline. So how that's going to work is pretty much I've got saline, Rocephin, saline, pump medication. This is going to go on for an hour and a half. Once you're done your pumping medications, you're going to then flush your line with saline, finish it off with some heparin, and cap it for safety with your green safety cap. Now, in order to get this medication inside of the bag, there's going to be a bit of a mixing process that has to occur. So I have a syringe, a needle, and a spike in order to do all of that. And right here, this is my pump. It's a Solus. It's an awesome pump. I really like it. It's really simple and easy to use. I was worried at first, but no, a few buttons, and I'll show you the simplicity of it all later. And this is what you use, the wires that you sorry, the hosing that you use to hook up to the pump and everything. Alright, so let's get started. Generally, first things first, like I said, I've washed my hands. I have been being extremely careful, and again, I'm just going to put some hand sanitizer on it because, like I said, you can never be too careful. Big thing that I really, really, really want people to take home from this too is that I'm really lucky. I have an awesome nurse that takes really good care of me, but I have had some nurses that have honestly scared me, and I'm lucky that I was smart enough to realize what was going on. Big thing is you really have to watch out and advocate for yourself. Like, make sure the nurses are washing their hands, they're not pulling on your line, make sure they're cleaning your line before they're putting any new medications into it. If you see nurses getting sloppy, you have to report it. You have to tell people what's going on. I mean, they could jeopardize your safety and put you into the ER, and you could get an infection, and who knows what that infection could lead to, and probably death at times. So don't want to do that. So I always take off my green cap to start. This is like a little protective cap that you put on. It has alcohol inside of it, so it kind of cleans it too as you put it on. Oh yeah, I totally forgot. So first things first, also before I start my infusion, I always get my alcohol wipes all ready and set up for me so that I don't have to even think twice about what I'm doing. So I just grab up, and my nurse has always told me you use 2 alcohol wipes if they're the little ones, because there's not enough juice on it to adequately clean your line. So make sure that you aren't stingy with your wipes and that you're taking extra good care of yourself. I put 2 down here because I've got to do a few extra cleanings in here, which I'll explain the details. These are for cleaning the actual medication bottle, because keep in mind, anytime you make contact with anything that is not sterile, you need to clean it. And that's a really, really big deal. And other thing is that if you drop something, if you accidentally touch something, never take the risk. Just take the extra 20 seconds and clean it with the alcohol wipes. All right, I've got all the wipes and everything set out. Like I said, organization is everything here, folks, especially if you've got brain fog issues going on, because this will keep you on track and it'll make sure that you're being safe. All right, we always want to start with kind of prepping our saline. So they come inside of this sealed package that keeps them all sterile and nice. I'll use my little trash bin, which I only use for all my medical equipment. It gets cleaned and it's also sanitized. And in order to kind of prep these for infusion, there's always air at the top of these. You know, a little air is not going to kill anybody. Like, I know they say that it does, but I asked the nurses, it would take a lot of air. So you just literally open the cap up to vent it, and then you want to push up on the syringe just till you see a drop come out. And then you know that the liquid has reached the top point and you've gotten all of the air out of the syringe. So, like I said, I'm particularly doing 2 infusions today. And I'm going to do these kind of back to back. So I will start out with administering the rocephalin medication, and as we wait for the IV rocephalin to be administered and go in, we're going to also be mixing our other medication, which pretty much mixing means we're mixing it and putting it in this bag of dextrose. Alrighty, guys. So, dun dun dun, the party begins. What we first need to do, always take your alcohol wipes, and I just kind of rip them at the middle, and then you can kind of pull the corners out, and then you've got them and you've done the least amount of touching. You want to take your line. You always usually have a clamp on your line. You want to unclamp your line, obviously, or you won't be able to get the medicine in. So this is the end cap for the line, which is the component during the infusion process, which is completely and utterly vital to keep clean. Okay, so if you accidentally touch this or anything, clean it again. I'm going to start with my first cleaning. I was taught by the nurses on the first round to do 2 clean wipes. That way you get the initial like crud off of there, and then you get 1 more sterile wipe. And you want to do this for a good 20 seconds just to make sure that, you know, you get a good clean wipe of it all. So, anyway, sorry, I'm trying to count in my head and talk to you at the same time. It's just not working for me. Alright, we've been at 20 seconds now. So now that that's done and it's all cleaned up, we're going to do 1 more just to be safe. And I totally hate making you guys bored and sit here for like 40 seconds because I know how this world is nowadays. Everybody wants to go, go, go. But if you can bear with me, I would so appreciate it. We can get to this next stage. The rest of it, yeah, it's just this part that's really the hardest part because you got to take the downtime and do all the counting. But you kind of get used to it. When I first started this, it seemed really overwhelming and I was kind of scared and all this kind of stuff. But, you know, now that I do it, it's like anything, you know, it just starts to become more normal to you. Not that IV medications should ever become normal. But unfortunately, that's where we're at today right now with my situation. And like I was saying before, people can get co-infections. Generally, if you get Lyme's disease, you get a whole plethora of different things. Babesia, Bartonella, Autoplasma. I always say that one wrong, so don't quote me on it because I have that one and it's really rare, but I never say the name wrong. I'll get all the names and everything perfectly laid out for you. See, even me, and I have these conditions, and still it's hard for me to keep track of everything in it all. I've unfortunately contracted a lot of co-infections, more than normal. It puts me in like, I think it's the 3% category of Lyme patients. So that's another thing to keep in mind about me. My situation is rare even for Lyme's disease patients. All right. I have hooked up the line and everything here. So pretty much all you have to do is take the cap off and you twist it in to the right. When you're administering your saline, it's what you just want to like push, let go. So it's like go into the bloodstream, let it mix, and let it go. Go into the bloodstream, let it mix, and let it go. You pretty much just don't want to like hit your bloodstream like all the way with a bunch of stuff. You know, you got to treat your body with respect and be gentle and loving and kind to yourself. And this is the way that you do that. And obviously the way that I was shown to do it. All right, so we are done. That's our initial start, is we always do a saline. Next, see how I have the alcohol laid out right there ready to go? Next, we're going to do another cleaning, because you always, again, I'm going to probably say this like a million times and drive you guys totally nuts during these videos, but you always have to clean your line. Unfortunately, it's just the way the game works here. But anyways, I was going to try to fill in the down times with a little bit of like details and stuff about my life and my situation. One thing I will say, I've just started doing these videos because if you would have talked to me 6 months ago, having a conversation with me was challenging. I was told by family that I was slurring words. I wasn't making sense. I remember I would see things like I was in such a state I don't even have words. So for me, I am noticing improvements on doing these IV medications. My cognitive functioning is definitely improving as well. So for me, I have noticed an improvement in doing the IV medications, and I do believe that they have been saving my life. Alright, so now we're going to start with the IV rocephin. So this is a sterile end cap. So because this cap end is sterile, that means that it doesn't require cleaning before putting on your PICC line. And as you just saw, I just cleaned my PICC line. I try not to leave it open for too long or breathe on it, because you do have bacteria in your mouth, and that is something to be considerate about. So I take that off very carefully. I'm never touching this tip, okay? Never touching this tip. They only meet and touch each other. And again, twists in to the right. So, big thing is if you did, let's say you touch this syringe. It's not like a saline, where if you drop a saline, you can just be like, oh, well, I'm going to get another saline. Well, you can't do that because this is your medication, right? So you wind up having to just take the alcohol wipes, like I do with this line, and clean that. And just, you know, make sure you're cleaning it again for 20 seconds really well and meeting all of the surface area while you're cleaning. Alright, now this is, again, what I said before. There's different types of IVs. This one is IV push. It's very quite simple, actually, which is why I don't want you to have to sit here for like 5 whole minutes while we do this one. But usually every minute, I push this up an increment. This is a total of 20 milliliters. So every minute you want to infuse 5 milliliters. And that's kind of how I do it. So it takes 4 minutes to do. You can do this infusion anywhere from 3 to 5 minutes. And I usually average for 4. I wind up doing it a little bit longer sometimes because I forget. But that's not a bad thing. It's still all getting into your blood. It's actually easier on your body, you know, if you're just not hitting it with a bunch of medication and you're kind of letting some of it go in and then giving it some time, let some more go in. That's kind of the concept with this, is you don't want to just flood your entire bloodstream with a whole bunch of medication. You need to make sure that it slowly gets in there and mixes. That's why they also use pumps like they do with this, but I'll go through that one in a bit. Alrighty, so all you have to do is literally push down, and like I said, I'm going to push it down 1 increment. Sorry, they always put this sticker on here and you can't see the numbers, but I've gone 5 milliliters has gone into me. How does it feel? If it's cold, you can feel the coldness, and you can kind of feel it in your throat and like a weird taste and like smell. I don't know. It's weird. Everybody has a different experience, but that's how it is for me. So for now, I'm going to put this down, and I'm looked at the clock, and in another minute or 2, sometimes I forget, I'll do the rest of that. And in the meantime, we're going to get started on the mixing of the medication. So this is IV Septra. Unfortunately, For me, I also contracted another disease called babesia, and I have to get that treated. And in order to treat that, I'm doing this IV Septra. I was also on this other medication called clindamycin earlier for the babesia. I've also got a Bartonella condition, which I think that can't be treated by antibiotics because it's a protozoa. So I think it's like antimalarials and stuff. But again, you need to talk to a professional about this. All this has been going on for me, and I've had severe cognitive functioning issues, and probably, have not absorbed nearly the amount of information. I'm slowly coming to, and now that I'm at this stage, that's why I wanted to do this video. So you guys can see this bottle here. I've just been cleaning it and cleaning it. This is the medication that we have to get inside of the bag. And so you, like everything, clean it for 20 seconds. They say 15 to 20 seconds. I just say do 20 and be on the safe side, because, you don't, I don't know, why take risks over an extra 5 seconds? But, alright, we're all good to go here. So this is nice and clean. I'm going to set it right here. In order to get this out, what I have to do is use a spike. So this is a spike. The good thing about the spikes are they have these blue caps, which keeps this sterile area, so you don't have to do any cleaning. Whenever I'm opening up my syringe, I open from top to bottom, and I usually, until I'm ready to screw on the spike, I try to keep the tip of it just inside the packaging for sanitary purposes. And as soon as I'm ready to hook it up, I'll just pull it out, kind of hold it here, quickly unscrew the blue cap, and I try to keep it away so I'm not breathing on anything, like I've mentioned. And you just, and it screws on, like really simply. It's not that bad. And like I said, this is probably kind of overwhelming, because I know I was like scared when this first happened, but I've gotten really used to it and comfortable with it. So if you're new to this, don't be scared. Take it one step at a time. And if you're ever confused or anything, make sure you contact a medical professional, and don't be shy to ask any questions that you might have. There is no such thing as a stupid question. That's what I always say. All right, so now we are ready to get the medicine inside of here. So pretty much I took the little, oh my gosh, I forgot, I should have saved that. That's okay. I have another idea for that. So because I threw the top off that I usually put back on to keep it sanitary, I'm just going to keep the bottle on until I switch it out for the needle. So we need the spike in order to get the medicine out of the bottle. So you don't, it's okay to push hard, get it right in the center. There's a center rubber piece on the bottle that you probably can't see, and you just, boom, jam it in there. And literally all you have to do, which is really nice because I've used needles to get the medicine out, and it's more harder and a little more complicated. I can show you the tricks of it. So you get it down to like almost empty, and the spike's poking out still a little more. So I always pull my spike a little bit, not touching anything, and kind of just tilt it to get that extra last little bit of medicine, because I don't like wasting anything, and I want to get better, so make sure I get every drop. And once I've inserted it into the vial, or the syringe, you just want to push this up like this. And I push it to the point so that the air kind of comes out, Next thing, see, because I threw away that thing, I'm leaving the bottle on here. This is keeping a sealed area for this. So it's keeping it nice and clean and sterile. I meant to say sterile. Well, sterile and sealed. Alright, so I'm going to open up this needle. When I open up the needles personally, they technically open up from the connection point to the needle point. I don't like to open it like that. I like to pop out the needle point and grab it from the needle point end, and keeping that covered and just pulling it out when I'm ready to insert this on, just because you don't want to touch anything that's connecting, because that's putting you at risk of getting any kind of nastiness whatsoever on that line that could cause and pose a threat for infection. So I take that off, and I'm just going to pull the plastic. Be gentle and be careful when you're doing things. You don't have to rush. And now I'm just going to push. It's okay if you get a little bit of air in the bag. I just try to not get too much in and push it up as much as I can without spilling any of the medication out of here. Now, as you can see, I've kind of spaced out and it's been a little bit longer than a minute. But so as I'm kind of mixing that, then what I'll do once I'm done, the next step is I'll come back to here and I'll push it in another 5 milliliters. And I kind of just do it slowly. I don't want to, I don't want to shock my body and shock my system, especially when you have Lyme's. You're usually really sensitive. Alrighty, so we are definitely now halfway done this infusion, and we're still mixing. So let's get back with that program. Alright, so here we have the bag. Now, the reason that we put this inside of the syringe is so that we can put the medicine inside of the bag now. So on this bag, there is this little end piece right here. And this little end piece is the piece that you need to clean because you're going to poke the needle inside of that. The cool thing about this end piece is that as you poke the needle in, it opens up just the right amount, keeping a sealed air gap between the needle so that nothing gets in, no contaminants, nothing, and only the medicine. And then when you pull it back out, it seals right back up after the needle, not allowing anything else to transfer inside. Bags can be different. I've had different bags. This one has 3 hookups on it. It just depends on the pump you're using and what you're doing. But generally all of them have this in order to put the medicine in. So here I'm going to go again and do another 20 seconds of cleaning and scrubbing. Sorry guys, I'm getting a little bit tired. It's been a long day for me, and one of the big things with Lyme's disease is that you get a lot of fatigue and really tired, and but I hope that today you guys are kind of learning something new, and this is kind of what my life has come to be now. Every morning and every night I do this and to medicate myself. And it's safer to do in-home infusions rather than going to an infusion center because less exposure to other people's illnesses and bacteria and all that kind of stuff. So if you're scared of home infusion, just keep that in mind that as long as you're smart at home about keeping your area safe, it's safer than going to an infusion center. So don't be scared about doing infusions at home. It's actually better for your health. Even if you have immunocompromised, because I'm immunocompromised now because of the Lyme's disease. I also have to get another kind of therapy called IVIG, which is other humans, like they donate their blood and they take the immunoglobulin out of it, and then I have to get that back so that my immune system can work. And it's a lot more complicated, but I tried to simple it out for the situation. I don't want to get too much into that one. Alrighty, folks, we are ready for the medication. So, uncap your needle. Don't throw this cap away, okay? Because you never want to throw a needle in the garbage without a cap. Somebody could get hurt. Alright, so I just line it up right in the center. You really want to be careful that you're lining it up in the center and you're poking down. The reason for this, guys, is that you could puncture the side of the bag or something, and then you've completely messed up the situation, and you'll probably have to call the pharmacy for some new medications or something. And that's not fun, trust me. Alright, so as you can see, I've inserted it in there now, and I'm going to flip the bag over. Oopsie daisies. Sorry, guys. So, I should have done it like that in the beginning, but so that you guys can kind of see the medicine going inside. I don't know if you can see it, because I'm a little far away, but I can see it just all going in there and mixing. And the big thing they've said, when you do this, like I said, don't worry if you get a little air in, it's totally fine. The big thing they've also said, though, to me is do not shake the bag a bunch to mix the medicine. It's not the right way to go, because you're going to get a bunch of bubbles and all this kind of stuff. So all you need to do is simply rotate, 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 and that's all I do. And you can kind of see when it becomes all mixed together, because it's not like cloud, like little, I don't know how to explain it, but you can tell when it's all mixed. It becomes a uniform solution. Alright, so, because I always forget this, Let's do our next 5 millimeters. This is generally how I do it. Each time I complete a task, I put this down a little bit. And so that way I'm killing 2 birds with 1 stone. Normally, if we weren't doing the mixing, we would just be sitting here and putting it every minute down. But I figure this way, keeps us busy, you know? I don't know, everybody gets bored so easy nowadays. You want to keep things rolling. All right, so to keep it rolling, right here, this is the tubing and the line that allows me to hook up to a pump, because I should have probably mentioned the IV Septra. I'm on a pump for an hour and a half with that one. So this is just an IV push, and this is an IV pump. And this is the pump and the lining that we're going to use to hook it all up. And I'm going to go through it a little bit better so maybe it becomes a little more clear to y'all. All right, and if you guys ever have questions or anything, I'm going to do my best to get back and respond. Just please keep in mind that I am in treatment and I am having a bunch of health problems, and I seem okay today, but there are days when I literally can't even get out of bed. So just keep that in mind, and realize that if I don't respond to you right away or something, it has nothing to do with you. I'm just trying to cope with my situation in my life right now. All right, so I've got the